Hi, everybody. Here's a quick discussion on the circle of Willis and the blood supply to the brain. The blood supply to the brain is coming from the underside by way of two arteries. They're called the vertebral arteries as they travel through the cervical structures called transverse foramina on their way up to the cranium, and they enter through the large foramen magnum. And once they're in at the level of the brainstem, early brainstem, the medulla oblongata, the two vertebral arteries join to form the basilar artery, shown here in the black arrows. Now, the vertebral arteries, once they bring you the basilar artery, the singular basilar artery will then be responsible for supplying the blood supply to the posterior aspect of the brain. So, all along the brain stem as well as the cerebellum will be supplied by the basilar artery. The basilar artery supply will end with supplying a large vessel to the posterior cerebral structures as well. So essentially, going down the line of the basilar artery, we have the anterior inferior cerebellars, which run along the underside of the cerebellum. Remember, you're looking at the brain from the underside. You also have the labyrinthine arteries that go out to the lateral structures that help the hearing apparatus, and hence you have the labyrinth, bony and membranous, in the temporal bone. We also have a series of arteries, 2 to 3 of them, called the pontine arteries, which run across the pons, as you can see here in the background. We have the superior cerebellar arteries that run over the top of the cerebellum between the cerebrum and the cerebellum. And then we have the posterior cerebral arteries that supply the posterior cerebrum. Now, the basilar ends with two vessels that are technically part of these two large structures called the internal carotids. The internal carotid arteries come from the common carotid arteries in the neck when they bifurcate at the angle of the jaw to give you external carotids, which supply the face, but the internal carotids move into the the carotid um, um, canal and the floor of the cranium, and from there they will supply blood to their branches, mainly the posterior communicating, shown right here, which then allow the internal carotids to join up with the basilar artery. In addition, they also put out anterior cerebral arteries, which supply the anterior portion of the cerebrum, anterior communicating arteries that then complete the circle, and anterior choroidal arteries that go deep into the brain to the choroid plexus. You also have the middle cerebral arteries that go off to the sides and supply the middle aspect of the cerebrum on both sides. This kind of takes care of the entire cerebrum. When you go to the cerebral cortex, it's as though the overlap of blood supply, if any, is minimal. Most of it is just right on the edge. So there's very little room for error. And should there be a blockage of a vessel, there is usually not another vessel from another side to take care of that deficit. That's why strokes can be prevalent if there's any kind of a stoppage of blood through these vessels. The other thing to keep in mind is this circle that we've created is not always a circle. We call it the circle of Willis, but this inferior arterial circle of the brain is not always 100%. In fact, if you look up Gray's Anatomy, they'll talk about how out of so many brains dissected, hundreds of brains dissected, there's a certain percentage of them have only a half of the circle that is formed, and others The entire circle may be formed, some three-quarter circles may be formed. So I guess, generally speaking, we're all a few arcs short of a full circle. This ends our discussion on the circle of Willis and the supply of the brain from inferiorly.